Hey, this is Different Careers with Kate Nudd. So, again, we're going over massage therapy principles and practice. We are on chapter 10. We have a few more videos to do, and I'll give you my perspective. Basically, it's as a massage therapist, you have to do intake forms, you have to file SOAP notes. And then in the last video, I discussed, well, some clients say they want to talk, then there probably should be a form that is more specific of like, what are the topics that you specifically like to talk about? What topics do you feel not comfortable talking about at all? Um, and then, um, and then if there's a box that says, I like talking about everything, well, then it's like, okay, well, you marked on the box that you were okay talking about everything. Obviously this topic came up and now you're not feeling comfortable because you changed your mind and communicated that with me during the massage. I'll stop talking about what is uncomfortable for you now, but you're gonna need to reevaluate what you mean by everything, because if you're not comfortable talking about this subject, and you want to stop talking about it right now, then you're not even okay to face the discomfort, to talk about it, to work through why you feel uncomfortable. So, uh, if something makes you feel uncomfortable, are you still willing to talk about it? Or are you really just wanting to end the conversation? Because that's okay, but it's like you can't mark the checkbox, I'm okay talking about everything, if you're really not. So that was like a solution I wish I had realized I needed to implement when I had my own private practice, I mentioned in the former video. And then I thought about it when I was working for a spa, and my boss didn't want to implement that. So they were unwilling to do that. So it was like, okay, my boss doesn't care about actually implementing any solutions. So, after having too many negative experiments as a not experiments, but having too many negative experiences as a licensed massage therapist, it's like, I hope the day comes where I can just switch over to robots and learn different massage techniques, work on robots, and then robots will be programmed to thoroughly give me a massage that is 100% effective. And then I don't have to deal with the real living being people that don't know how to communicate properly with me, because the robots would be programmed to communicate properly and effectively. And so, like, you could run through different scenarios of like, this person has this condition, how do you treat them effectively and properly? And they would actually help teach me the right way of doing things, instead of everyone making everything up and being like, I want this condition of this to be the healing solution. I'm sorry, that's not how science works. But it is what it is. People came in and they thought they knew better than a licensed massage therapist, for the most part, how to be treated. And they asked for deep tissue, and it was like, well, maybe deep tissue or deep pressure, however they were trying to define it, isn't actually going to help heal them, because it didn't help heal me. There was some other component missing, and I think it was, well, if a whole bunch of people are speaking negativity over you and diseases over you, then you need someone to actually say a blessing over you that actually works 100%, specifically to actually heal different areas of your body, including your tense muscles. But no one was willing ever to do that for me. So that's why the massages didn't really work. So they worked for a little bit for a time, and then the negativity got worse and worse, is my theory, where it was like everyone just doesn't want anything to work properly for me anymore. So it is what it is. So I will switch over to robots eventually, and my life will get so much more positive because robots will be programmed to do their job effectively and efficiently. And if someone, doesn't want to do a good job, well, it's like, well, all these licensed massage therapists that claim to be licensed and claim to be able to help me, they never were able to 100% effectively help me. So it was like, well, I wasted my time, which time equals money. So sometimes I did massage trades to basically get a massage for free, but I always felt like I gave a better massage than them, but they claimed that they gave a better massage than me. Well, then how come your massage didn't work drastically more than mine? And then I paid for some massages, and still it seemed like they were charging way too much, because again, they didn't effectively help my condition and really bring drastic relief to my back. So it was like, what are you people doing? You claim you are better and that you've done this longer than me, but yet I still have muscle tension in my back after a massage. What? Like, you didn't really alleviate any of it at all. Even if I paid for a deep tissue, even I asked specifically that you work those knots out, you didn't effectively make the massage last for a long enough period of time so that I would feel relief. So then my muscles it's like the same day my muscles got tight again. And it's like, what? Okay. So again, that's the main reason why I just want to switch to robots and give up being a licensed massage therapist, where the only way I'd probably be a licensed massage therapist is doing training videos, talking about it, because literally clients and my previous boss and all the bad experiences that I had, it literally made it so I want nothing to do with the hands-on approach of actually touching a living being. Like, I don't trust anyone anymore that they will provide a safe, loving environment for the licensed massage therapist. That's what I was trying to do as a licensed massage therapist for all my clients. Like, I want you to know that you can truly talk to me about anything. If there's something bad going on in your life, I want to be a safe person that you can talk to. Well, instead of having that type of environment, like, they attacked me for being open and honest. So I got in trouble for talking and for sharing my real experience. So again, it's like, I came to the conclusion people want me to lie. They want me to give them false information. They want me to make up a story. Well, then that's on the communication paperwork. I should have put in, oh, are you wanting me to make up false stories about what's actually going on in my life, and spontaneously make something up? Because, if they gave me permission to do that, I would have been happy to oblige or do that in the moment. But that's not what they told me. No one ever truly told me what they wanted to hear from me. So I'm like talking like I'm experiencing real life, and I'm in this negative environment. I want to get out. And sometimes I would talk and like how do we make our environment more positive? Like I was trying to come up with solutions and talk at the same time, because everyone's like, we need solutions. We need to be the solution. We need to be the change. That's what I heard growing up. Well, at the end of the day, no one wants to be the change. They don't want to implement the positive changes. And so it's like everyone was just talking, talk, 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 talk. They don't actually mean what they say. That's what was coming across to me. So it's like, well, I would have rather a whole bunch of clients just tell me, you know what? I don't want that kind of practice. I don't want you to create this environment where people can talk about negativity and positivity. I don't want you to do the Rosen method. I don't want you to express any of my emotions. We don't really believe in emotions, So don't even bother, trying to implement that into your practice. No one's going to ever come to you. Just do it for yourself to get your certifications or your continuing education credits, but don't try to implement it into your practice at all. So I wish someone had told me, oh, society's really not interested in the Rosen method and expressing any real emotions. No, no, no. We don't believe in emotions at all. I wish, people would have been frank with me, but it's like they created this Christian environment growing up where it's like, oh yeah, be real, be genuine, be honest. Well, being honest means you're honest about your emotions too. You can't create a religion and basically take out the emotional component and be like, I'm sorry, you're not allowed to have any emotions, but you're gonna have this religion. But that's basically what they were trying to do, is create a Christian religion where you have no real emotions. And it's just like, really, you're gonna have emotions. You may need to evaluate, the difference between positive and negative, and assess why you have negative emotions. Like, did you go through a bad experience? Did someone give you false information? Did someone steal something from you? Did someone tell you you're stupid or you're an idiot or you're dumb? Did someone hit you or slap you and physically hurt you somehow? You're gonna have emotions in a negative environment, and some of them will be negative and some of them will be positive depending on your experience. If you have more positive experiences, you're going to have more positive emotions. If you have more negative experiences, then you're going to have more negative emotions. So it was like they were being ridiculous, and they're like, you can't trust your emotions at all. So it's like, if your feelings tell you to do something, it's completely wrong. Well, if your feelings tell you to sin, yeah, or to do something morally not right, yeah, then you need to evaluate like why you're wanting to do something that's wrong and would hurt somebody else, right? Or yourself. So again, this is like my religious confusion. I'm agnostic now. I believe the religion that I grew up with is 100% false. But I'm not going to get into like all the belief system. But again, it's like you have that Christian environment. They taught you not to lie. They taught you to tell the truth, to be honest. And so I was implementing this Christian principle into my massage therapy practice, being honest. So if someone said, how are you? I really truly believe they genuinely cared about me as a licensed massage therapist, and they really wanted to know some of the stuff that was going on. Maybe not all the details of everything, but I really thought they wanted to know. And because they were asking the question, how are you doing? you know? And I tried to do what I was taught in massage school, which was be client focused. And it's like, well, if the client asks, how are you? They're like wanting to focus some of the attention on the licensed massage therapist. That's what was kept, that's the message, of the words that kept, like they kept using, and that's like what kept coming across. Like, we want to know how you're doing too. Well, it's like, well, you're sending mixed messages to me if you're saying, I want to know how you're really doing, and then you're like, no, I really want the massage focused on me. Well, it's like, well, you can share part of the time, or it's just, I just needed to know the boundaries of like, do you just want me to talk about myself for 5 minutes? Do you want me to share for 10 minutes? How long do you want to share? So there might need to be a communication paper, which they did not go over in chapter 10 of like, if you ask the question, how are you doing? How long would you like me to talk about myself during the massage? Or, whatever. And again, you're not getting paid for some reason, you're not getting paid for the time that it takes to get the client on the table, and the time it takes for the client to get off the table, change the table over, and get ready for the next client. You're just getting paid for the hands-on time. That's how this governmental system set up massage therapy, which is not fair at all, because that time adds up. And it's like, why can't you get paid also for caring about your clients, even when there's this extra time where they're getting on the table, off the table, too? Why can't there be a different kind of system where you get paid for all the work that you truly do? So I didn't like getting paid for just the hands-on manual time for a massage. It doesn't work. It doesn't pay the bills. So, that's why another reason I want to switch to robots. You have that robot, you pay for it once. That robot is good. If it's made with good quality, it's going to last you a very long time and work and operate and and function well and do a better and thorough job than a living being that did not want to address the real issues that were going on in my body. So, so if you have negative experiences, it's going to push you out of a profession. If you had good intentions in that profession and you really wanted to do a good job and everything, if your experiences with people are just negative the majority of the time, you're gonna get burnt out, and you're like, I want nothing to do with it, and I want nothing to do with living beings. And so that's kind of where I am. Is like, initially I had abusive experiences with touch as a child and stuff, and it's like, it made me go into the profession because it was like I was drawn to it. And then I realized, learning massage, like, oh, this could help heal me. And then you had more negative experiences with clients, and then it like put you back in the same condition where you're like, I guess people don't want me to heal. They want me to experience negativity. They say, be more positive, experience more positive experiences, find the right people. But I couldn't find the right people who were wanting a two-sided real relationship with me, where it's like, I'm a friend with you, you're a friend back, we contact each other and see each other and be like, how are you doing? And then it seemed like the people who were my friend for a time, it's like, you're too negative all the time. You like, I can't handle being your friend. You're not positive enough. You don't have enough fun. And it was like, well, I kept having all these bad negative experiences, and it was like, Are they on a different planet than me or something? Because how come they get to have all these good, awesome experiences and seem like they enjoy life and everything's good and golden for them, and then everything's like mostly negative for me the majority of the time, and then it's like, I'm not allowed to talk about it. So it was like, oh, you don't really want to be a real friend. So that's why I have no real friends. I have Snuggles here, who is okay with me talking and venting about all my positive experiences, all my negative experiences. You know, I only have Snuggles, you know? That's how it is. So people didn't want to be real and genuine with me. So if people call themselves my family, well, they don't act like a real family. They don't behave like a real family. They don't actually treat me like they really genuinely love and care about me. If I tell them something that I need, they don't care about providing that need for me. Okay. And this is just the basics of food. Like, I'm becoming allergic to certain food. Can you please buy this instead? They literally like groaned and grunted and like raised their voice at me like, oh, you're so annoying. You're so irritating that you have this need for this specific food. Like, that was their attitude towards me. So it's like, you can't even ask someone to love you and treat you nice and be kind and speak loving tones of voice to yourself, apparently, or to me, because they'll be like, you're so annoying, you're so irritating, is the tone of voice that they project to me. So it's like, oh my word, like, what did I ever do to you? You're the one that's claiming to be my real mother. You're the one that's claiming to be my real father. If you're not my real father, if you're not my real mother, then stop saying that you are, you know? Because they don't act like it. They don't talk like they really are with gentle, kind, loving words. So their actions and their behavior don't line up like I'm their real daughter, because they don't really care about any of my needs at all. And that has been there from the very beginning. I was ignored. I was neglected. They didn't care about my emotional well-being. They didn't care about me having true fun. They didn't care about all my nutrition needs and things that I wanted. They didn't care to make sure I got a true religion. They were okay handing me a false religion and making me believe it for years. So everyone's probably laughing at me behind my back about all the negative experiences I've been through, and they think it's so funny and so great that they made me go through all these negative experiences, and they're laughing and they think they're such good, positive people. But are they really? No. They're not loving. They're not kind. They got an evil virus is probably what happened. There's something mentally wrong with all these individuals that I've interacted with. But I am trying to do stuff to still be positive in spite of everyone wanting to be negative. So let's get to the rest of these massage videos and see, you know, what other paperwork they have here.
Hi Dottie, my name is Susan. I'm going to be your therapist today. I see that you're down here for an hour massage, and I've got your health history here. I'm looking at it, and you seem to be very healthy. You've had a massage in the past. What did you like about that massage?
Well, I've had several, and the last one I had was really great. And the therapist, she was very strong, and she really relaxed my muscles and everything. I've also had one that I wasn't too happy about.
Tell me about that.
Well, she just wasn't. I really didn't feel like I was relaxed or anything.
So what I hear you saying is the deep pressure makes the difference.
That's right.
Okay. I see you have no medical conditions I need to be familiar with. You've had any past surgeries?
No, I'm pretty healthy. And
What about any injuries, slips, falls, motor vehicle accidents?
no.
Your primary purpose for being here, is it stress relief? Is it pain relief? What needs to happen today?
Well, I would like a massage where she would work on my lower back. I've been working out in the yard, raking the last few days with all this storm. And also I do really like massage when she works on my legs. That's because I'm a runner and I'm very active. I do aqua aerobics 3 days a week, and I do a little weightlifting. I try to exercise. I like to exercise like an hour or so a day, but some days, I don't get that much in. And it's
Very good. Any kind of skin allergies I need to know about, or skin conditions you have?
well, as I'm older, I get a little.
No medical skin conditions, right?
No, I don't have any.
What about any medications you're on?
No, I'm not on any medications except I do take a estrogen, Premarin, and I've done that with doctor's advice.
Okay, you've had bone scans. Your bone's pretty healthy.
I just had a bone density test last week, and he said it turned out fine. I did.
Okay, what we're going to do today is we're going to go in the massage room. I'm going to start with you face down. I'm going to spend the majority of the time with you face down, since I'm going to dress your legs in that position, your back in that position. I'll get your arms and feet, and then when I roll over, I'll finish the work on your legs. I'll do a little work on your neck. Do you mind if I work your face a little bit?
Not at all.
Okay, I'm going to finish with a little bit of pressure point work around your face. Okay. Well, I'm going to escort you to the massage room, and I'll show you where you need to put your clothing, and I'll wash my hands, and we'll get started.
Oh, great. Okay.
So to me, this interview is kind of confusing because, like, in the interview, like, this lady, the client coming in is like a small individual. So basically, as a licensed massage therapist, I would basically be like, okay, so sometimes people think they want deep pressure, but you just want me to really match the pressure of what feels extremely comfortable to you. You may need to have a pressure range, because the way you're sounding it is you want some more specific work in your lower back and your legs, both sides, and then work and it's like, I guess she signed up for full body massages, the context of the licensed massage therapist, where it's like, well, if these are your problem areas, well, you might actually need me to work the front side of the hip, go through the abdominals, focus the lower back and your glutes and your legs for the whole 60 minutes. If like there's more specific work that needs to be done, because it just takes more time to thoroughly work out the deeper muscles that are in your body. You can't go over them even with harder, deeper pressure, and like thoroughly work the deeper layers of the muscle. You may hit them like superficially with deeper pressure, but it's like it's not really gonna like be effective if there's like really major problems. So it's like like if the person is really wanting more relaxation massage, then with like the massage wasn't really relaxing because the massage therapist that I didn't like, they were doing too light of pressure. It's like, well, the client isn't like the massage therapist in this video isn't asking specific enough answers, or to be like, okay, what went wrong with the wrong massage therapist versus what went wrong with the right massage therapist. And it's like, well, probably the one that did it right, they hit the pressure and just did the normal massage relaxing strokes where you're lengthening the muscles, broadening the length, broadening the muscles, and then lengthening again. So that's what I'm getting from this interview is they're not even communicating well with each other, because there's different massage modalities, there's different types of massages, and it's like, even with relaxing the muscles, it's like, okay, you can still go over the lower back and the legs a little bit longer, and still do a full body. So it sounds like to me, it's like the paperwork may be showing something else. I don't know. Let's go to the next interview.
Hi Neil, I'm Sue here for massage today. I've got your health history right here. You've never had a massage before?
Never have.
Okay. I'm looking at, you have some arthritis. Is it osteo or rheumatoid arthritis? What kind of arthritis is it?
It's osteo.
Osteoarthritis. Where is it affecting you the most?
Mostly in my hands and in my feet is where I have the most trouble.
Hands and feet. Okay. Is it in flare-up or remission right now?
It's in remission.
And for how long has it been in remission for?
Probably a month.
A month? Wow. Do you know what triggers it?
No, I don't know what triggers it. Wish I did.
Yeah. Yes, so you have a heart condition. Can you give me a little bit of information about that, please?
I've had I have some blockage in my but not enough to require a stent or a bypass.
Okay.
But we're watching it, treating the cholesterol.
Okay, but no medication, no blood thinners, anything like
I take
that?
cholesterol medication.
Just cholesterol medication? Okay. A past surgery. Tell me a little bit about that.
I ruptured a tendon in my arm with an accident, and
Or right or left arm?
in my right arm, right forearm.
Okay. Do you know, you'd have to know the tendon, the muscle name.
No, I don't. It was the main tendon, but I don't know. But it took about 6 months to recover after that surgery.
Tell me how old the surgery is. When did you have it?
I had that about 3 years ago.
Okay. And physical therapy. You had physical therapy after that surgery, correct?
I did physical therapy probably for 3 months, and the therapist was good.
Did they massage it?
No, it was strengthening exercise, but it was very, started out very light, and we progressed into, more rigorous therapy.
Do you think you can handle some applied pressure to that area?
Oh yeah, it's fine now. Yeah, I'm fine.
Your primary goal for today would be pain relief or stress relief?
Pain relief.
Okay, and the areas, I'm assuming your hands and feet are okay to work because they're in remission?
Yeah, they're okay.
Okay. I'm going to start with a medium pressure, and then I'm going to just ask you about deeper or lighter as we are in the massage.
Okay.
In your
Yeah,
feeling.
great.
But what is the main area you would want worked on, since you kind of got a variety of things going on? What would be the main area of concentration?
The first area, the most important area?
Most important
My
area.
hands.
Hands.
Mhm.
Okay. Okay, and pain in the rest of your body would be,
Feet and right arm.
okay. Do you happen to have any skin allergies or skin conditions?
No, I don't.
Okay. Tell me a little bit about how you use your body each day. Lifestyle, are you on your feet a lot? Do you sit a lot?
My background is construction worker, and then into the management side of construction. So I still stay active.
Okay, you're on your feet a lot, but your back was not a problem, so your posture is very, very good?
I've not had a back problem.
That's fantastic. Okay. So today, Neil, what we're going to do is I'm going to have you enter the massage room. You're going to lay on the massage table. You're going to be draped with sheets the entire time. I'm going to start with you face up.
Okay.
I'm going to spend probably the first up to 15 minutes working on those main areas. I'm going to work on your hands first, then I'm going to work on the feet and that right arm. Is there anything that I need to know about you? Anything else you can think of so I can give you a good massage today?
I think that covers it.
Okay. Well, let's get started.
Okay, thanks.
Okay, so I have a problem with the second interview too. So this guy's coming in, he's proclaiming a bunch of different health conditions. It's not 100% clear to me everything, because I don't actually see the paperwork in front of me myself, what his health conditions are, but it's basically arthritis in the hands, feet bothering him, and it seemed like an arm or something like that. So he like really to make a drastic difference. Well, if he's complaining about arthritis pain in his hands, I'd be like, you really need a hydrotherapy hot and cold treatment, because that's what I was taught in from naturopathic doctors, from even in massage school. They're like, you can do hydrotherapy with massages in your scope of practice. So I would advise doing a hot and cold treatment on the hands, right? Okay, if they don't want to do that extra service, then it's like you really need to spend 5 minutes on both hands or 10 minutes on the hands, massaging them, loosening up the muscles, not 15 minutes for all the problem areas. It's going to take a lot more time than 15 minutes to work on all the problem areas, okay? So then it'd be like, okay, you have 5 minutes for each hand and then 5 minutes for each foot. So that's 20 minutes of this massage right there. And then he mentioned a third problem. So then you may need 10 minutes for both sides, or actually 10 minutes for both sides to thoroughly loosen up the muscles in a gentle way. So really the whole 60 minutes, just to be on the safe side, you'd be like, it'd be better if these problems are really bothering you, that I like just spend the whole time thoroughly working the problem areas only. You know, it is his first massage. So it's like, clients came in and it's like, really, I wanted to do this thing of, hey, here's your first massage. And then people come back. But literally, one of the things people said in massage therapy school, if you don't treat them right away when they're coming into you for pain, and effectively help them the first time around, they're probably not going to come back. So it's like a catch-22 kind of thing of like, do I give them a regular relaxing massage? Do I try to make it so we just focus on their problem areas during the massage and not massage the rest of the areas of the body? Because people really do like a full body massage. But it's like, people were balking at the price. They didn't seem to have unlimited funds, because if they had unlimited funds, you'd be like, okay, I recommend a 2-hour massage or a 4-hour massage, or let's do 2 hours, take a half an hour break or something, get hydrated, and then do another 2 hours, so you get your everything fully worked on and relaxed, or something like that. So it was like, if money's not an obstacle, then it's like you really need thoroughly work the whole body, and we need to make sure it's gentle, right? Because then you're making sure to get everything. And so like, that's what you would really want to do. But it's like, when people are like, I have this problem and this problem and this problem and this problem, well, to thoroughly work the muscles, for the muscles to feel relief, you have to work it longer. You can't just massage the whole body, work these areas a little bit longer and be like, oh yeah, I got relief. Okay. So I don't like what this licensed massage therapist is saying in this video. It's not accurate concerning health, and it's not accurate concerning how people told me they felt relief after their massages. So let's go to interview 3.
Hi, Brianna, here for a massage today.
Yes,
An
ma'am.
hour and a half massage today.
Oh, yes.
You must really need some work. So tell me a bit about yourself. I see that you're a massage therapy student.
Yes, ma'am.
Have you graduated yet?
Not yet. I still have a couple more months to go.
So I see you must get lots of massages. Tell me what do you like in the best massage you've ever gotten?
I like a lot of deep tissue work, and mostly in like the trapezius and quadratus lumborum, and I like a lot of stretching in the hamstrings and quadriceps area.
As you're sitting there right now, close your eyes and tell me if there's any place in your body that is screaming the loudest for work.
Probably sacral work.
Okay, so low back and sacrum.
Yes, ma'am.
Okay, and that actually will be good for we'll do some low back stretches too to address that area. And you like a lot of deep pressures. Do you have any kind of allergies or skin conditions I need to know about
No,
first?
ma'am.
Okay. Obviously, you bend over a massage table a lot.
Yes. I try and use my body mechanics as much as possible, but every now and then I'll slip up.
Okay. Do you think that could attribute to some of your sacral discomfort?
Possibly.
Okay. Well, we'll address that, and what I'll do is even after the massage, we'll go over some body mechanics to make sure that you're in perfect alignment. Tell me a little bit about your anemia.
I actually became anemic when I got pregnant with my daughter. It just kind of showed up one day, and ever since then I've, been trying to increase a little iron and health foods and kind of cut back on a lot of sodas and sugary foods.
How old is your daughter?
My daughter's 16 months.
Are you nursing?
Not anymore.
Okay. Because that could contribute to the anemia unless you're taking good prenatal vitamins and really supplementing your diet. When's the last time you've been checked for anemia?
About 3 months ago.
Okay. And that you were still clinically
Yes,
diagnosed?
ma'am.
Okay. Now you said you like a lot of deep pressure with the anemia. Have you ever experienced any kind of bruising
No, ma'am.
or any excessive soreness after deep pressure?
If the pressure's a little too deep, then I might. But it's not very often. I'm usually a little more prone to being cold.
Oh, okay. Well, I'll tell you what, with that, I'm glad you said that. With that, I'll make sure you stay draped with a blanket the entire time. And if you really want to, you can leave on your socks. Some people love to leave on socks, especially if they're prone to be chilly. You have any questions for me before we get started?
No, ma'am.
Okay. Well, since you've had a massage before, we'll get started right away, and I'll escort you to the massage room.
Absolutely.
Okay.
So what's coming up with the third interview is it really seems like the person that's in school to become a massage therapist, that they're like just making up a bunch of conditions on the fly, because they're trying to do a mock interview. And so it's like when they went over this in massage therapy school, that's kind of how it was. You were put in these like mock interview situations, but it was really like discussing your intake form, like health conditions and stuff like that. It was like I was like thrown into it, and I was like, shouldn't we have learned pathology first before doing this intake form? Because it doesn't make sense unless you understand the pathology stuff and like the diseases and how to treat different diseases properly and stuff like that. And so I literally thought pathology class was going to be like, okay, these are the diseases. This is how you treat this disease. And then when I like read all the descriptions of massage, it was like, it didn't really specifically tell you like the best massage modality to treat certain conditions or whatever. It was like super broad and vague. The pathology book didn't really help me at all. And I was like, what is this? Like, I'm more confused on how to treat clients. This is supposed to like clear it up, and it didn't really help at all. And so I was just like, I'm so confused. It brought more confusion going through pathology. And so literally to understand the intake form interview stuff, it was like, okay, I went with, okay, can you please describe your condition that you have in not medical terms? And then I was like, then I could like tweak what I learned in school to be like, I think this is how you would treat this individual. And so I really focus more with like muscle problems, muscle tension, stuff like that. Because like inflammation, it's like, well, inflammation is caused by either injury or you have some chronic health issue going on in your body, right? You're not getting the proper nutrients, and so you have some kind of inflammation on. Massage is not really going to treat the inflammation. It's going to help bring a fresh supply of blood throughout your whole body because you're massaging the muscles and the skin and everything. So it's like the severe medical stuff. I was like, if you have severe medical problems, go to a doctor. I'm not a doctor. I'm not diagnosing you. So it was like muscle stuff. I'm good. If your spine's out of alignment, you need to see a chiropractor. You know, like the anemia stuff. It was like someone said I was borderline anemia when I was in my first year of college, and my blood was tested, and they're like, because of they like looked at the dry color of my blood, they're like, oh yeah, you're borderline anemia. And so it was like, is that really true? Because I didn't feel like I had any blood problems or health conditions concerning the color of my blood. And I was like, I'm so confused. So again, you keep coming to the same conclusion. I think some people were making up health conditions and, oh, you're going to have this problem because your blood's this color or whatever. And it's just like, is that really true? What if you're on a certain diet of food colors or something, and like you're getting certain kinds of colored food in your diet? Is the food make it so that's what you look like? Or because people are trying to say genetically you look a certain way and it doesn't matter what you eat. So it's like there's opposing, like, what is the true scientific evidence? No one ever gave me true scientific evidence where I could research how cells in your body actually react to different colors of food. Like, does it actually change any of the color of the cells in your body? Like, what's going on? So it's like you need sound science to also diagnose health conditions. It has to be accurate. People can't be making stuff up and be all over the place. And so it's like, for me, I need scientific evidence that what these people are saying are true when it comes to health conditions, because it's like people told me, oh, here's the solution. Like, if you get a massage, it's going to relax your muscles. If you get your knots worked out, you're going to feel tons of relief. And that didn't happen for me. So it's like, I'm sorry, I don't think you people know what you're talking about. So, what they say doesn't add up with how my body responded to their solution. So if the solution doesn't work and isn't effective, like, then their science doesn't work. So let's go to the last video now.
Formulating the plan of care. During the planning process, the therapist uses the intake information to outline the parameters for the massage session. It is based on all the information the massage therapist has gathered: the client's intake form, the interview, and other assessments such as palpation. After integrating all this information, the massage therapist uses knowledge of anatomy and physiology, massage therapy skills, and awareness of the effectiveness of techniques to determine what treatment will work best for the client. The treatment plan also takes into account the client's financial and time constraints. With practice, the planning process will flow naturally. A good plan of care includes techniques and areas to include or avoid, Recommendations for self-care. Self-care supports soft tissue healing, promotes client participation, and reduces therapist dependency. Suggest an activity that would fit easily into the client's lifestyle. Tie the suggestion into something the client does daily. For example, suggest gentle stretching of the neck under a warm shower stream. These are to be done between scheduled appointments. Other examples are stretches, self-massage with or without tennis balls. For example, lying on 2 tennis balls placed in a sock that is tied at its open end. This greatly reduces head and neck tension. Stress reduction techniques such as meditation, guided imagery, breathing exercises, and strolling outdoors. Sleeping with proper support such as pillows under the arms and legs. Nutrition such as increasing intake of fiber and water. Ergonomics such as computer monitor height or getting a phone headset. Regular exercise such as weight training. Salt and soda bath, 1 cup each, soak for 20 minutes. And ice and heat. Duration, frequency, and length of treatments. Reassessment. The method used to measure improvement by the client and by the therapist, such as a decrease in pain or increase in range of motion. Referrals. Refer the client to a chiropractor, a nutritionist, a personal trainer, biofeedback technician, yoga or Tai Chi instructor, or any other appropriate services to benefit the client and help him achieve goals. The plan of care may also include whether the client needs assistance, use of support or bolstering devices that are out of the ordinary, use of any adjunctive therapies such as aromatherapy or hydrotherapy, or suggested reading material such as books found in local bookstores and libraries. After discussing the proposed plan of care with the client, make any appropriate revisions. Once complete, ask the client to sign and date the document. This signed document represents a give-and-take dialogue that must exist in a therapeutic relationship. Subsequent sessions. Following the initial session, prepare for future sessions by briefly reviewing your PPALM notes for that client. This will assure the client of your attention to his or her care and provide for client safety as you review any health concerns, noting any lack of progress that may necessitate modification of the original treatment plan. One of the most valuable skills a therapist can learn is to be an effective listener and communicator. By assessing and understanding the client's current health status and chief concerns, you can devise a treatment plan that includes the appropriate massage therapy techniques and areas of treatment. Ruling out contraindications. As the therapist collects information on the client intake form and during the interview process, he or she is also screening each client for the inappropriateness of massage or contraindications. A contraindication is the presence of a disease or physical condition that makes it impossible or undesirable to treat a particular client in the usual manner. If a local or absolute contraindication is determined through assessment, it influences how massage will be applied or may rule out massage therapy entirely. Following are some helpful guidelines. Treat as a local contraindication if the condition is due to an injury that is less than 72 hours old, such as whiplash or ankle sprain. If pressure causes unwarranted pain, such as corn, callus, or bunion. If the area is inflamed, such as carpal tunnel syndrome or acute bursitis. If the area in question is confined to a small space that can be easily avoided, such as athlete's foot for the foot or feet, or irritable bowel syndrome for the abdomen. If it is an abnormal finding, such as suspicious lumps, masses, or moles. Treat as an absolute contraindication if there is a widespread inflammation and the condition is acute or exacerbated, such as rheumatoid arthritis or lupus. If the condition is due to an infectious agent, such as fungi or virus, or disease, such as strep throat, pneumonia, or scabies. Until his or her physician can be consulted if the client's symptoms become more severe for any or no apparent reason, such as Parkinson's disease or scleroderma. This is revealed during the pre-massage assessment process. Make sure the client has signed a medical release form. If the condition represents a medical emergency, such as meningitis or appendicitis.
So that was a lot of information. Again, you need true science and you need a pathology book. I was scared that someone would try to come in and get a massage if they had lice or scabies. Basically, it's bugs eating and your skin, and it's extremely contagious. No one ever came in. However, people did come in with bad hygiene because their feet stunk and they wanted their feet massaged, or they came in with bad breath and, their mouth stunk and it's like they didn't brush their teeth. And I did my best to have good hygiene, taking a shower every day and everything. And then, like, if I forgot to brush my teeth, I would just, put peppermint essential oil that was safe for consumption, or like putting in your mouth, and it would give me better breath. So that's kind of how I did it. But it's like people didn't even use breath mints, apparently. So again, proper science. So my philosophy basically ended up being, okay, certain medical conditions, you need to go to doctors, you need to go to nurses. I don't know how to help you. I'm a licensed massage therapist. It's not in my scope of practice to treat certain diseases. If people were complaining about like chronic pain that never goes away, it's like, well, maybe you're not eating the right foods. You need to see a naturopathic doctor. So I was like, go find one, basically was my advice, because muscle problems are muscle problems. Muscle tension is muscle tension. Chronic pain, that you have chronic pain for a reason. And so, like, one of the things I realized after I stopped working on people is like, oh my gosh, like from 12 on up, I've had inflammation in my body and it went undiagnosed. The doctors never actually did any proper tests on me, and I probably had inflammation in my body constantly. That's why I never got well. That's why I never fully healed. I was like, oh man, I received all these massages and all these chiropractic adjustments, and I have inflammation in my body, and that's why I'm getting worse, and that's why my feet hurt after I walk a whole block, I could, I guess, do 4 massages in a day, and it's like, well, you sit down in between clients, so it was like your feet got a little bit of a break, right? Or you're moving around, you're not like walking, you're standing still. So it meant different kind of pressure on your feet, I guess. I don't know, but it's like, why is walking the whole block causing pain if you're not standing for 4 hours? And standing for 4 hours, it didn't make your feet hurt and hurt and hurt. Like, why are my feet hurting? So it's like you have these questions, and it's like, well, I guess these people are just saying they're doctors, they're saying they're nurses, they're saying they're legitimate chiropractors, because no one has legitimate science answers that actually work to get rid of the pain in my body, because they're like, go to a plant-based diet, go vegan, and all your problems will go away. Well, you go stricter vegan, well, the problems aren't going away, things are getting worse. So again, do we live in a society where you can bless yourself or others, or curse yourself or others? So if that's really the root issue of why I'm sick or have health problems, then the solution is you have to say a specific blessing over different areas of your body, and eat certain food for your diet. Say those specific blessings, get massages, chiropractic adjustments, stretch, and say those blessings with the solutions, the physical solutions, for them to work properly. Otherwise, they're not going to work properly. So, you need true science, and the religion has to go with the true science. And so, everyone's saying whatever they want. So, again, I have gone through a lot of negative experiences. I wish I had a wonderful, positive experience only, but that's not what happened. So, on my channels, in my videos, positivity and negativity are allowed to be here. And I look forward to the day where I can have a robot that is programmed to thoroughly do an effective job at giving me a massage or chiropractic adjustment, or tell me exactly what I need to eat specifically, like be a robot doctor, with real solutions that I can actually implement, that work, because this whole science health system that I've been in a negative environment, it doesn't work, because what I tried to implement, what they said would work, and it was proven through personal experience that what they said didn't work at all. So be careful listening to what other people tell you. You need proof, you need evidence that what they say for science is actually sound science, true science. Because if they give you a solution that doesn't work, then it's like, well, then they weren't using true science. They were using false science information. So be careful when listening or implementing other people's advice. Make sure it's true science. So that means we need scientific experiments to be done. So, hope you found this video helpful. Until next time.